Another thing which is very common in most hospitals in Ghana these days, and a lot of people have been brainwashed, typhoid. Doc, a lot of people say they have typhoid, and almost every month they say that their typhoid has come. Their typhoid has come. What is typhoid? How does it present?
They have personalized the typhoid, eh?
Yes, yes, it is not their property.
Yeah. Okay. So, typhoid is an infection that is mostly diagnosed clinically and then confirmed with what we call culture, either a blood, a urine, or a stool culture, depending on the time the patient is coming to see you. Okay. So, typhoid, as I know it, a lot of the tests people are doing around, they are even doing the what do you call it? I've even forgotten the name. It's been a long time I saw that test.
Is it Wida? Wida.
Without, thank you, without. So the without is not, it's not sensitive for the organism that causes enteric fever or typhoid fever, which is Salmonella typhi. There are a lot of other Salmonella species that cross reacts with the Salmonella typhi. Therefore, if you have an infection with those other Salmonella species, most of them harmless, the test may come out as positive. Okay. But usually patients with typhoid, they will have fever, they may have chills, they may have headache, they may have abdominal pain. And then they will come to you. You examine them, you try to rule out all the other conditions, and then you sometimes request a culture or the antibodies as well. These are supposed to help you. They don't in themselves make a diagnosis of typhoid. They are supposed to help you put all the clinical information together, put the labs also together, and then make the diagnosis of typhoid and then treat it. And typhoid, as we know it, is treatable. It's treatable. Okay, it's treatable. Somebody may harbor the infection and then transmit it. They may be chronic carriers. But then for the one who has symptoms, okay, this is a treatable infection. There are antibiotics that can treat the typhoid infections. Okay. Otherwise, if it's untreated, it can lead to some other complications. Some of them neurological complications, some of them surgical complications, such as typhoid perforation. Okay. So it's a treatable infection. It's not something that anybody should be tagged with. That's typhoid. And some people I know, they go every month to collect typhoid medications. Please, exactly. It's not like that.
Exactly.
It is never like that. It is never like that. Yes.
These days, a lot of the labs in the hospitals are doing IgG and IgM tests. What are the implications of those labs when it comes out positive or negative? What does it mean?
Okay, so basically, if you have typhoid, usually the IgG, IgM, they indicate the state of infection. Okay, so if you have an acute infection, usually the IgM, immunoglobulin M, to the typhoid is the one that comes out as positive. And if it's a chronic infection, then it's the IgG that will usually be positive. Okay. So, but like I was saying, these all help us. They help us to make a decision, make a clinical decision. At the end of the day, you are not going to treat the lab. You are going to treat a patient. You are going to treat a person. Okay. So these help us to manage our patients.
Doc, you made two very profound statements. The first one is that the typhoid test that is run in the hospitals, it can come out positive as a result of other species of salmonella that's cross-reacting. So a positive test does not necessarily mean you have an acute infection. Is that what you meant?
Yes, that's what I said.
Exactly. Good. So most people keep going and they test and it is positive and they go and take medication. 1 week. Next month they go. They go and take. So it becomes something chronic.